This podcast is for general informational, educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. All right, welcome everybody to another episode of PHM from Pittsburgh. I am still your host, Dr. Tony Tarchichi. In case you're new to us, I'm a MedPeds trained pediatric hospitalist here at UPMC Children's Hospital of Pittsburgh in the Paul C. Gaffney Division of Pediatric Hospital Medicine. This is one of our special PHM21 Conference podcast episodes. So off the bat, we are not having CME associated with these podcast episodes. So I apologize if you were looking forward to that. But this is our What I Learned Today at PHM. In case you're unsure, today was the first day of the PHM21 conference, and it went off, I think, with a bang. It did really well. And again, full transparency. I'm on the PHM planning committee, so it's a little self-serving when I compliment how well the conference went off. That being said, I really do think it was nice. So we have a wonderful group of distinguished guests with us today who I was very happy to come on. I'm going to let them introduce themselves. We're going to go around the horn. They're going to introduce who they are and where they're from. These are all PHM fellows, and we're going to do what I learned today at PHM. So, Dr. Sharp, you're up first.
Hi, my name is Eleanor Sharp. I go by Ellie. I have the great fortune of training at the University of Pittsburgh under Dr. Tony Tarchichi, and I am a second-year fellow in pediatric hospital medicine, and I am thrilled to be here.
Dr. Patel, you're up.
Hi, everyone. I'm Purva Patel. I'm one of the second-year PHM fellows at Baylor College of Medicine, Texas Children's Hospital, and I'm super excited to be here. Huge fan of this podcast.
Thank you. And Dr. Lim.
Hi, I'm Jordan Lim. I'm a second-year fellow also at Baylor College of Medicine at Texas Children's Hospital, and I'm a fan of the podcast as well and excited to be at PHM virtually.
So we can, I'll start out with one of the things, there was a bunch of stuff I went to and there's a bunch of stuff I really liked. Initially in the morning, I was in the med ed conversation first thing in the morning about podcasting. We started talking about podcasting, which is clearly a very fun topic for me to discuss. And Chris Liu from Curbsiders was there. We had a real fun conversation. So I loved that. So Ellie, you're up.
All right. I just want to say, I'm pretty sure, Tony, wasn't the first thing you did yoga this morning? Didn't you do PHM yoga? Wasn't that before?
I did that for 15 minutes and then I went to the med ed conversation. Yes. But the yoga was great.
So I think the most impactful part of today was probably the plenary presentation by Dr. Ela Alhadef, and just his story and the way that he has really turned this horrific and tragic event in his life into action and advocacy, and the language that he uses to navigate, very politically charged situations and still be a mentor and really a leader in that space, I think is really inspiring. So I really appreciated hearing from him. And then my other favorite presentation was just the choosing wisely. So PHM, the top 10 recommendations, and then some extra bonus ones as well. I think it's always so interesting to sit in on and listen to those types of presentations and just see the different questions that come up from all of us hospitalists all over the country, and even with things that are pretty protocolized and, we have lots of guidance about. It's so interesting to see the variability across institutions and how people approach similar clinical scenarios with different prior experiences and also different understandings and interpretations of the literature. So I think one of the, specific pearls that I acquired from that session was about not starting IV antibiotic therapy on well-appearing newborns that just have like isolated risk factors, so maternal chorioamnionitis. And I think that that also points to the fact that as hospitalists, we work so closely with people or with specialists, in different divisions, and really need to have buy-in across the board from evidence and from things that we do. So, if the obstetricians that also practice with us feel strongly about a diagnosis or a certain practice, we are not only responsible for taking care of our patients, but also for kind of working with the other care team members. And we at Pittsburgh do not currently use have the sepsis calculator, but I know that some institutions do have that kind of ingrained in their electronic medical record. And I was really impressed by the fact that the use of those calculators reduced the antibiotic use by, I think they said 50% or more, but did not lead, that reduction in antibiotic use didn't lead to any increased incidence of early onset sepsis. And so I think that provides really good evidence that we may be exposing these infants to more antibiotics than they need. And so just, again, a really, really nicely done session. You can tell that they put a lot of work and a lot of research into making their slides, making their presentation, and really crafted their top 10 recommendations with a lot of thought. And so I just really appreciated it.
That's great. All right. Purva, I believe you're up.
Thank you. So, Elliot, I couldn't agree more. The plenary and the choosing wisely were super awesome. I wanted to highlight one of the workshops that I went to today, which was channeling your inner coach, techniques to enhance clinical teaching and feedback. The two overall kind of concepts that we went over and talked about in our small groups was how to create a learning environment that focuses on growth mindset instead of focus on performance. And so took some really great pearls away from there, including normalizing that to your learners that you yourself are always learning. And a way to do that is to assign each person on the team, from the medical student all the way to the supervisor, third-year residents, the task to teach the team about a topic on each day that you're on with them. So definitely we'll be taking that back with me. And then the other thing was explicitly introducing the concept to your learners that you are a coach. And so going over that, this will involve asking questions and observing and then giving them feedback to help them progress towards their goals. So that was a new concept and a way to think about how to give feedback to your learners that I'll definitely be implementing going forward.
Now, Purva, that was the only sold out's the wrong word, but full session where there
really?
wasn't any room. Yeah, there wasn't. I tried to get in. I was a couple minutes late. My kids were home.
Yeah, but she just...
I took
some notes, so I'm happy to share them with you.
That was so great. I feel like, Tony, that was all you needed.
I may not have to watch it now. That's
now we
great.
know the real reason.
Really
I feel like we were all there.
That's great. All right, Jordan, you're up.
Okay. Well, definitely agree with everything that's been said. To add on to that, so I felt like there was a hidden curriculum throughout all of today, which was the newborn curriculum, which I thoroughly appreciated. So there were several talks today all about the unwell well baby in different forms, which was really interesting. One that I found really engaging was the not so well baby, which were oral clinical conundrums. And I just think in general that it was really interesting because of highlighting the times and what is, I use air quotes for well baby, when things aren't well or when there are abnormal findings. I feel like a lot in PHM, we inherently, our patients are sick, right? They have admission criteria. There's a chief complaint. So we kind of know when we start thinking clinically about them that it's problem focused. And I feel like when, as hospitalists, when we address patients in the newborn unit, it's almost the opposite. And it's kind of like a different way of thinking about things, which is interesting, where your inherent bias is that they are well. and you have to kind of find that needle in a haystack, like which is the one that isn't, or which one of these things is a newborn finding that's totally fine, or which one needs more workup. And so it's just a different way of thinking about things that's intriguing. So a lot of the talks today focused on those abnormal findings, but that talk in particular was very engaging. And there was a lot of back and forth and different cases that they presented where there was one small abnormality that either was totally normal or was, a harbinger for an underlying syndrome and things like that. And so they just did a great job of leading that session. And really, there was a lot of back and forth too with specifically newborn hospitalists that were in academic centers and those in the community, and how things would differ and your availability of consultants and things like that. So I found it really engaging. And then on top of that too, just wanted to shout out to the PHM stories. I know that they're new, but they were incredibly powerful today, all of the speakers, and really just highlighted like very vulnerable and authentic stories. I feel like a lot of times in conferences, like we come and we hear these great accomplishments of people's careers and new research and all these things, but to have people really be vulnerable and show parts of themselves that we don't always put on a platform or put in front of 300 people was really, really impressive and moving, but definitely resonated with everyone because there was lots of feedback. And I think everyone's had a moment when we felt similar to that too. So I thought it was a great addition today.
I could not agree more. That the PHM Stories is a new addition this year. Being vulnerable and honest about your insecurities and your failures and things that didn't go the way you wanted to in life is one of the hardest things to do. To do it in a conference full of your peers is incredibly brave. And everyone did it with grace and dignity, and it was just superb. I absolutely loved them. I really loved them. And Jordan, I have to tell you what's so interesting. The newborn talks, I went to that one you went to. At Pittsburgh, we don't do newborn medicine, but I found myself drawn to the talk, and I went. It was fantastic. They had, I don't know if it's the same one, but they had the one where they had the really great pictures. The one child had like testicular torsion from birth, and they had the pictures up, and I was just really learned a ton, and I found them really good. Now, can we talk about? Let's bring up the plenary speaker. We brought her up a couple times. I have been coming to the PHM conferences since I think 2014. San Antonio was my first one. That was the best plenary talk I've ever had. That was moving. I mean, honest, vulnerable, incredible, superhuman resilience. I genuinely don't think I could have done anywhere near what the presenter did in terms of his life and how he reacted and responded. And he was so honest. When things were bad, when things were low, he talked about it. And it was just, I loved it. It sounds like everyone else did too.
Yeah. I agree. I think it also kind of echoes Jordan's comments about PHM Stories and how I think it's really nice that in this space, there's this undercurrent of, recurring themes of like this year, the past couple of years have been really hard for people, I think, in different ways, in very unique ways. And, giving space to acknowledge that not everything is a perfect plenary talk at a conference, and that's just not necessarily how life always works. And if 2020 taught us anything, that I think is one of the biggest pearls that I took from that. But I really, really, again, appreciated how he came and shared his story with us, and I'm sure that he has inspired many, many of us today.
Yeah. I mean, he got laws passed based on what he did. It's him and his wife. He gave his wife a lot of credit because it was a group effort after the tragedy they had to suffer through. But we also had the top research abstracts. I got to tell you, every year I feel like they do, and everyone says this, but it's true. They get better and better. Some of the ones that I picked up that I really was interested in, the one on the AAP guidelines on maintenance IV fluids, Dr. Ralamini presented. I didn't know we have covered the maintenance IV fluids AAP guidelines on a podcast before. What I didn't know is what her study showed is how that one guideline so drastically affected so many institutions. There was a significant increase in isotonic maintenance heavy fluid use after them. And then after her Sophie intervention, even more. So that was really fantastic. Colorado did a retrospective study using person time analysis on a patient claims database. And they went through and kind of talked about person time analysis, which I did not know was a thing.
Yeah. I thought the infographic or like the figures that they had in their presentation were very helpful in terms of helping people that are not person time analysis experts understand what they were talking about.
So there's a couple others I have, but did anything stand out to you all if you happen to get to the research abstracts?
I thought that the discussion, I think it was the Colorado group that looked at, the use of controller medications in patients less than 2 years old and whether or not, after their first lower respiratory tract infection, and whether or not the use of controller medications prevented, a subsequent emergency room or inpatient hospitalization. And the way that they analyzed their results and their methods were really interesting. And I think the question of, is this asthma or is this bronchiolitis or is this asthmatitis is just such a common dilemma and such a important question that any research or any guidance that can come out on that topic I think is really helpful. So they found that the use of controller medications for this patient population, so patients less than 2, was not associated with any significant changes in emergency room visits or hospitalizations. And, I think that just adds to the body of literature in how we kind of categorize patients that come in with wheeze and are less than 2 years old.
I'll tell you what else I really liked. Vanderbilt did a talk on Get On Board with Behavioral Health, a novel approach to patient care. It was with Doctors Whitney Browning, Greg Plemons, and Allison Herndon. And they had this new novel, because all of us have been dealing with mental health, increase in mental health in children, and more hospitalizations and boarding and less beds because of COVID. So they had this new method where they had a psychologist on their inpatient service. They proved they had a whole model where they set up a standardized definition, standardized treatment plans. They showed a decreased length of stay and cost savings. So they actually got a second psychologist on and a psychiatrist. And it was a really nice inpatient model for all of us to look at and at least pick things apart and see what we can use because, nationwide, this is a thing that's growing. I don't know that it's going to go away anytime soon. So I thought that was extremely helpful. Did you all, was there anything else that stood out that you liked about the day?
I went to just finished up actually and just to put a plug in for the speed mentoring that is offered every year. And I know that Purva also went because we were in the same group.
I was just about to mention it. So
amazing. So I think, I just am so wonderful that that's something that is organized every year. And also that there are enough mentors that are willing to donate, so much of their time and energy after a really long day of being at the conference. They're still willing to spend the evening offering guidance and meeting residents and fellows and people like us that are, establishing our careers in PHM. And I think it really just kind of epitomizes why this field is so wonderful, is that it's full of people that are so excited to educate others and to mentor others and to really kind of do the best we can for patients by also bringing each other up. And so it was just, a really nice way to end the day.
I couldn't have said it better myself, Ellie. Just highly recommend it to all attendees for future conferences to sign up for it. You won't regret it for sure.
Yeah, 100%. It was kind of a perfect arc to the day to end with mentorship. And then one of my first things today was the New Kids on the Block workshop, Thriving in Your First Faculty Position. And so just kind of, which was super helpful and tips from people at different parts in their careers. So having mentorship be on the bookends of that day was really nice.
Oh, that is wonderful. And I will tell you, it's an interesting challenge to be home for a conference, because at one point I was folding laundry. At one point I would make dinner. My wife was taking my kids to orthodontist appointments and other things. And at one point I was doing math with my daughter while I think it was the Vanderbilt lecture happening, and I'm doing arithmetic. Well, it was a full day of doing other stuff, but it was fun. It was fun. How was the challenge of being home for the three of you? We'll start with you, Purva.
Honestly, it wasn't terrible. If I kind of got tired in my desk chair, I moved over to the couch. Like you, I folded some laundry that I needed to. I do love traveling and I love in-person conferences, but it wasn't as bad as I thought it was going to be. It was actually kind of nice.
I think there's my answer right there. So it was great. This was as my 3-year-old walked in. It was great to be home. There's lots of new challenges with COVID in this year. But I will say that, it was definitely a unique experience. I think at one point during the PHM stories, when people are telling their beautiful stories, I had Anna and Elsa. My dog was dressed as Anna, of course, and 3-year-old as Elsa. So, there's a place to be had for the camera off button.
Yes. That sounds like a great image, though. I really got to say. Ellie, you're up.
Yeah, I am I'm biased because I just loved the in-person, the first PHM conference, the only PHM conference, that I went to before COVID was in Seattle. And it was just such a incredible experience and really kind of reinforced my decision to go into PHM and to apply to the fellowship, and meeting all of the people and seeing what a small world it is. And just kind of I think one of my favorite things was just going and seeing people recognize each other from across the room, and they hadn't seen each other for, since last year's conference, or, in 5 years and 10 years. And it just immediately their faces would light up, and seeing those kind of spark of recognition and those connections that really are just maintained through these conferences, maintained through our shared love of PHM and taking care of patients. And that was so inspiring to me. And I think it's hard to recreate some of that virtually. I think shout out to the social media team this year. They're doing the Twitter activity is incredible. And they really they have done a fantastic job making the conference feel like a, in-person conference. But I will very much look forward to when we all get to be together again in person. And I think, that will hopefully be, we'll see, but hopefully it'll be next year. But I think in terms of a virtual conference, today was really, really fantastic.
I don't have any more questions. I think it was a great day. I'm looking forward to tomorrow. I told everyone on the podcast before, I'm very much looking forward to Fauci and Doctors Fauci and Beers giving their talk. I think it's Friday, but I'm very excited for that as well. So I'm sure it's going to be another great day tomorrow. Purva, Ellie, Jordan, thank you so very much for being on the podcast. I really appreciate it. We really enjoyed it.
Thank you so much. It was so much. It's really fun to be on this side of it after, being on the other side for so long.
Thanks for having us. We're looking forward to Thanks for having us. Definitely looking forward to day 2.
Yep. Already have my agenda all lined up and ready to, hopefully not have many interruptions tomorrow, but we will see. It's always an adventure.
Tony, I think Fauci is tomorrow. Actually, I was just double checking my calendar, so you'll be able to chat about it tomorrow.
Oh, it's going to be exciting. Thank you, Purva. Thank you very much.
What kind of beer are you going to drink with Fauci, Tony?
Let me tell you, that's such a clever name, Beers with Fauci, because it's Dr. Beers and Dr. Isn't that
amazing?
I know.
I love it.
All right. Thank you all so much. Well, I really enjoyed this. I hope you enjoyed it too. Have a great time. I'll see you all throughout the conference.
Thank you.
Quick acknowledgments. Thank you to the University of Pittsburgh, who supports this podcast with free CME. Thank you to the UPMC Children's Hospital of Pittsburgh for supporting this podcast as well. Thank you to our wonderful guests again, Ellie, Purva, and Jordan. Thank you for being on the podcast and for your time. I hope to see you all throughout the conference this week, rest of this week. And thank you, as always, to Dr. Megan Keene-Tarchichi, who helps me with everything.
Thank you for